So now, we talked about this diffusion process, passive diffusion, facet diffusion, active, endocytosis. We also talked about Fick's law. We talked ionizations here, right? After, what other contributes these absorptions? Blood flow, guys. Blood flow is very important because different parts of organ, the blood is going differently, right? So that's the reason why blood flow also plays a very, very important role into here, all right? And obviously, what can interfere with the absorption basically as a route of administrations, all right? Whether it's passing through the liver or not, all right? Other one is basically the drug-drug interaction also plays a very, very important because there's other drugs, like for example, if you give like a drugs, that can be inhibited by the gastric acid, then that may not have like a lot more effect, all right? So that plays a role. Drug-drug interactions, obviously the route of administrations, all right? And obviously this ionizations also plays an important role or interferes with the absorptions, all right? Now, after all this, drugs has been absorbed into the plasma. Let's say in this vascular compartment, right? When the drugs in the vascular compartment, what is going to happen to the drugs? The drugs, it needs to do what? It needs to, go and redistribute to the other parts of the area. Now, this is where we talk about when the drugs comes here. We'll talk about this. What is going to happen is that when the drugs come here, let's say you took orally drugs, right? What is going to happen is that as this drug comes here, it's going to go like this. Because this is basically the absorption state right here. It's going to go, and if you keep increasing the dose, it's going to keep going up, let's say, keep going up, and then there's some time, let's say we've been talking about like aspirin, so let's stick with aspirin. You continuously giving drugs, so once you hit aspirin, like let's say, maximum plasma drug concentration, what does that mean? Which basically means, we say sometimes like a Cmax, which basically means is that concentrations of the plasma of the drug, basic, that's what it means. So when you hit that, and usually concentrations is equal to what? Concentrations, or plasma concentrations is equal to, you can simply say this is a dose. Right? Dose, or you can say, actually, let's make this easier. Mass over volume. And that's the extracellular volume. Vascular compartment volume. That's what we're talking about here. The concentration, we're talking about the concentration drug, the plasma concentration is determined by mass. Mass is what? A dose, like what's the drug amount that you're given. And the volume has to do with the, how much fluid is present here, like the volume. And usually we measure the volumes in what? Like, sometimes we say like liters, right? cc, if you're giving injections, this is like 1 cubic meters, which basically means like 1 milliliters or something. And then this is mass, and mass are usually milligrams, right? So when you give like drugs, right, what happens is that you reach a certain position right here. Let's write down here. As you keep giving a drug, you increase in the concentration drug. Like this is a plasma concentration. It's going up. But remember, it needs to require certain amount of drugs before it start having its effect, right? So if you give like, let's say this, let's use an example. Let's say that, this person needs to take at least like 100 milligrams of this drug, like, I don't know, aspirin. But then if you give, let's say, only like 5 milligrams, it may not have any effect at all because there is a certain limitations required for that to have any actions, right? And for that one, we call them a minimum effective concentration. So this is the point where it needs to reach before this drug start working. So let's say this is a minimum, effective concentrations, right? This is the point right here. And this is we said time right here. And this point right here, this point, what do we call them? We call them at this point right here from the 0 to the minimum effective concentration. And this is where we're going to have what? Action. So we call them onset of the action. This is a very, very important concept. Like if I make this one right here, this is what is called onset of the actions. All right? And then after that, what is going to happen? If you keep increasing the dose, it's going to keep going up. And it will start keep having effect. But remember, it will have effect when it's reached its maximum level, meaning the plasma concentration is the maximum level, then after what is going to happen? No matter how much you increase the dose, once it's reached its maximum concentrations, it will no longer have any effect. Okay? It is not going to relieve the pain. It may have other effects, like it could result into toxicity, but the response, okay, response to alleviate the pain would not increase by increasing the concentrations of the drugs. All right. So let's say this is a maximum level. So we say usually C max. All right. And this point right here, if you're down here, we call them a T max. Okay. That is what is the time at which the maximum concentrations occur. Like for example, let's say this is 2 hours. This is, let's say 1, 2, let's say 3 hours. In the 3 hours at the time it reaches its maximum concentrations. All right, but after that, once it reaches maximum concentrations, by increasing the dose, it's not going to increase its maximum effect. Let's go with that, all right? Now, this is a Tmax, right? And this graph, whole thing is showing the absorption, because you're getting absorption, right? And this is a minimum effect constant. And after it's going to get distributed, and then after what is going to happen? It's going to come down like falls like this. All right? It's going to start falling because the drugs, it's getting what? It is getting metabolized, going through a process called biotransformations, and then when that go to that, the drugs becomes inactive, all right? There are certain drugs that become active too, something called pro-drugs, which basically means is that, the drugs, you take the pro-drugs, which is inactive form, but then later in our system, what it does is that it activates it, right? It converts inactive drug into active drug, and we'll talk about that. But just like quickly mention that too. And this is coming down, this is elimination phase, and this come down here and goes like this, all right? And remember, when it comes down here, it is still going to reach this position here, which is also called minimum effective concentration. When the drugs, okay, when it's coming down, right, when it's going biotransformations, it's going to coming down like in a change. Look, drugs do not get destroyed, okay? What happens is that there will be alterations on their chemical properties. Lipid soluble drugs, they become water soluble drugs, okay? But they didn't destroy it, right? So what is going to happen is that it is going to have a lesser effect. So the effect will start decreasing, right? The effect of the drug will start decreasing, and once it's reached the minimum effective concentrations, and when it falls below, you will no longer have the effect of the drugs, right? Because remember, if you take the Tylenol, one Tylenol, would that work for entire your life? You have to take it again, right? Because they have a certain time, okay? There's certain time, there are limitations of that. What happens is that they will work until, they're based on how much drug you have taken, once they reach their, let's say, half-life, I'm talking about this one too. And what is half-life again? The half-life basically means that, when you reach the maximum plasma concentrations, okay, and you break down into 50, when you divide that, let's say you reach the maximum plasma concentrations, and when the drugs falls down by the 50%, that's what's called half-life. I know, guys, I'm like moving around a lot of places right here, but really I want you guys to focus into this, and we will go again and again about this too, all right? But remember, one thing, the most important thing here is that, when this concentration of maximum plasma goes, when the drug reaches that, even if you give more drug, it's not going to have any respond to alleviate the pain, but instead it might give you like toxicity and other adverse effect, but it's not going to alleviate your pain, all right? And obviously after that, biotransformation happens, metabolism happens, and then it will become inactive form. And once it's, again, when it's a minimum effect, once it reaches the minimum effective concentration, what is going to happen? The drug will no longer have effect, and then after that, what is going to happen? They will get excrete out from your kidney, okay? And this place, right, hold this, or maybe let's say like this is, let's say we can say 4, let's say this is like 5 hours and this is 6 hours. This phase right here, this phase is what we call them a onset of actions, all right? This is what is called like from here to here, or this is what's called duration. I mean, I think it's, sorry, this is called onset of action right here, but this whole point is called durations of the action of the drug. And this graph is important graph, right? So this drug is There's a whole concept is called durations of that drugs, meaning that that's the time it took to reach its half-life. Basically, you can think of it that way, right? Because once it reaches, then it is probably going to go. It's going to excrete out from your system. All right. So here, a couple of things we talked about here. We talked about onset of action, duration of action, minimum action of the concentrations. We talked about all of that, right? And this is very, very important concept, right? You should know about it. All right. Now, this is the absorption, right? So when the drugs get absorbed, right, in the plasma, the one thing that we also have to talk about here is that, these drugs, if you take orally, all right, let's draw. Orally, what is happening here is that if you take intravenously, obviously you guys know, it's directly going to go to this, right? But if you take like orally, what is going to happen here is that, let's say from the, GI, we'll make a GI right here. From the veins right here, gastric vein, portal veins, right? It's going to bring all these things to liver, right? And from the liver, because liver stores hepatic veins, it's going to go to the systemic circulation, right? And this is where, okay guys, this is where the liver is where that's what the drug's going to go, something called biotransformations, all right? And this is where, guys, when it gets the biotransformations, this is where, they lose, some of the drug get converted into inactive form. And when you get inactive forms, what is going to happen here is that, when you get inactive forms, that means the bioavailability of the drugs reduces, which means that the fractions of drugs that gets into this systemic circulations, that reduces. Like for instance, let's say we look at the graphically too, and you say the bioavailabilities, whenever remember, there's a plasma concentrations of the drugs right here. There's a time, right? And remember, orally we say like this, right? This for intravenously. And whenever we give oral drugs, it gets observe, and then it's going to go down like this, right? So whenever we find the bioavailability, we just do this. We just do bioavailability, or use the letter F is equal to what? Equal to AUC, which means area under the curve. And this is going to be oral, so like right here. And then UC, area under the curve, like intravenously. Okay, if doing that, if the bioavailability comes like 1, that means this bioavailability tells you that it becomes 1, and when you multiply 1 by 1 times 100, that will be 100%, right? That means that if the bioavailability is 100%, that means that drugs, 100%, whatever amount of drugs you have given, 100% that drugs has reached the systemic circulation. But if the bioavailability decreases by 1, that means that some of the drugs that you have given, the 100% drug did not reach, only some fractions of the drug that reach the systemic circulation. That's what basically this bioavailability tells you. All right, the fractions of drug, that went to the process called first pass effect. All right, and the main site for the biotransformation happens is in the liver, but there are other areas that also happens in the liver, kidneys, also even small intestines. All right, that's what this bioavailability basically tells you, and I've already talked about that too. But anyways, and this is like area under the curve orally. This is area under the IV. All right. Now, once the drugs is here, right? Once the drugs is here, what's going to happen is the drugs is going to get distribute. Once the drugs is here, it's going to go distribute. And it's going to distribute the other parts of the area, right? Like for instance, right? For instance, if you give, let's say, any drug, like sedative drugs, like we'll make it here. All right? If you give us sedative drugs, and if you give, let's say, if you give orally, first it's going to go to the systemic circulations, right? And from the systemic circulation, first where it is going to go, that is determined by what? Blood flow. Right? Because remember, blood flow to what? If you think about it, blood flow to your skin is very, very less comparing to the blood flow to, let's say, or even blood flow to the heart is very less comparing to the blood flow to the brain, blood flow to the kidney. There's a normal physiology, right? There's an increased amount of blood flow. And that really, because of that, because of that, that determines how you feel too. When there's increase in blood flow to your brain, that's why whenever you give sedatives, right, you have directly effect on your brain. right? Because it increases blood flow, so drugs can easily go. And especially if it's a lipid-soluble drugs, it can pass the blood-brain barrier. So that's the reason why, whenever you give, let's say, plasma, this is 100% plasma, right? Whenever you give, let's say, there's something like you see, because these graphs will, you see steep graph, and this is going from here, let's say, distributions happens, and this will basically happen to the brain here, or even like kidney, all right? But some of the drugs, what happens is that, they'll go, and then as it's coming down, as it's distributing around, they'll go and later they'll get accumulated at, let's say, fat cells. And if that happens, then usually what happens, this will, graphs will look something like this. And this looks like a fat tissues or fat goblet. And even the muscles too, like, the blood flow is like usually lower, right? Comparing to the kidneys and brain. So because of what happens is that these graphs also look something like this. All right, and comes like this. And this will be like muscles. All right? So this is just a redistributions of the curve. But whenever we talk about the distributions, one thing that we're going to talk about is that, we ever talked about the biotransformation and also the plasma protein, because when the drug comes in here, it can also bind the plasma protein. And remember, drugs has to be the free form in order to have its biological functions, all right? So we also have to talk about how much drugs are bound to the plasma protein, because that also reduces its action to the target tissues, all right? And usually whenever there's a distribution is there, distributions, they use these equations that I want you guys to remember, and that is called, distribution is equal to what? Basically, our distribution is equal to doses, right? And the distribution referring as like, VD, which is the volume of distribution. Look at this, right here. Because this volume is we're talking about distribution right here, right? Volume, doses, and then like how much drugs you take, and obviously this plasma concentration, like CO. What is the plasma concentration of drugs? Okay, this is how, like, mathematically or through equations, you can able to figure out how much drugs has been distributed to that particular organ, okay? And these are distributions equations right here, all right? Now, let's say that this drug went to the distributed, it went to the tissues, and it had its biological function. Then after that, what is going to happen is that these drugs, it cannot always get accumulated in our body, right? They have to, they have to somehow eliminate it from our systems. And how does that get eliminated? And this is where the biotransformation comes in, right? And whenever we talk about biotransformations, there are a couple of things we have to talk about. There's something called phase 1 reaction and phase 2 reactions. Okay, that's what it's going to take. And that usually takes predominantly in liver. Phase 1 reactions and phase 2 reactions. Now, we talked about, observe, this is done. We talked about liver reactions. We talked about distributions a little bit, right? We did talk about that, and then now we're going to talk about the metabolism or biotransformation, same thing. Biotransformations. In here, right, when the drugs comes in here, in the liver, this is my liver, right? This is where the biotransformation takes place. And as we said, there's a phase 1 and phase 2 reaction, right? And whenever we talk about the phase 2 reaction, let's say this is a drug right here. I'm just going to make this a drug right here. Okay, let's just make this a drug right here. When there's a drug right here, right? What is happening here is that this drug, usually if they're, if they're lipid soluble, even they're better. What happens is that there's an enzyme located here. Okay? And what happens is that, this is a phase 1, or we also call them, it's a non-synthetic reaction, phase 1 reactions, or like synthetic reactions, non-synthetic reactions, all right? And what they do is like, they alter the property of these drugs. They don't destroy it, but they alter it. Basically, if this is a lipid-soluble drug, what they do is that they make a water-soluble drug, so that way it can actually remove from our systems. So they make water-soluble drugs. And how do they make water-soluble drugs? By adding a couple of enzymes. And what are those? Those are called, okay, these are enzymes are basically like, let me write down here. Hydrolysis enzyme. All right. Other one is oxidations, reductions, and who is doing this? P450 cytochrome. P450 cytochromes, or we also call them a monooxygenases enzymes. And these are usually located in the endoplasmic reticulums, okay? Very, very important, P450 cytochrome enzymes. All right, so this P450 cytochrome enzymes, all right, these are the one, what they do is that they catalyze this phase 1 reactions. And usually this P450 cytochromes, they give specifically this thing called like CYP. Do you know where this comes from? This is a numerical way of writing, and that's an Arabic way of writing numerically. That's how this CYP came from, okay? And then the CYP, and then there's like numbers and the letter like 2C. And also other one is a CYP 2D, CYP cytochrome, and there's a 3A, and there's a cytochrome CYP 3A4, like this. One thing that these are like different, cytochrome, they belong to the same family, but these are just different cytochromes, and the subgroups are divided into this couple. The reason why is that these are enzymes, right? Basically, they catalyze the phase 1 reactions, and this is specifically to specific drugs. But I do want you to remember one thing is that the CYP3A4, because the majority of the drugs, the abundance of the drugs that has been metabolized by this enzyme, which is called CYP3A4, and they use this property, hydrolysis, oxidation reductions, in order to biotransform medications. So what is hydrolysis basically means? Hydrolysis basically, if it's a lipid soluble drug, right? Then what are you doing? Hydro means water, lysis means what? You're breaking this compound by adding the water. That's what hydrolysis basically means. So you basically add water into this compound, right? And you make a water-soluble compound. What is oxidation basically means? Oxidation means, look, you can think about oxidation as oil. Mnemonics. You are oxidizing by losing electrons, right? That's what you're doing. So what are you doing? Basically, if you add, or you can simply say you're oxidizing by gaining an oxygen molecule. So if you keep giving more oxygen, then this is going to become water, right? So that's what basically this oxidation makes. You're just adding water to this compound to make more water soluble. That's what you're basically doing. Water soluble, or waters are what? They're polarly charged compound. Or you're unmasking basically, this polar compound of this drug. And that is what oxidations, reductions, hydrolysis basically means. So whenever you make this drug, let's say this drug is now very, very sad because it's about to, come out of the systems right here. Very sad right here. All right? Because it's going to come out of the system right here. Now this is what's called phase 1 reaction right here. All right? Now, after the phase 1 reaction, there is also another phase that this drug go. And that is called phase 2 reaction or synthetic reactions. All right. We add something else with it. We conjugate this molecule with something else. And what is conjugate means? Con means you're adding something else with newly fresh this polar compound, right? And you do it either you add glucuronic acid, let's write down glucuronic acid, or you do sulfuric acid, or we call them sulfations, or acetic acid, or we call them acetylations. Basically, when you add this together with the gluconyl transferase enzymes, which basically means that it's transferring the functional group and attaching with this polar compound. When you do that, and this is what it's called, okay, phase 2 reactions, or you can simply say these are synthetic reactions, or you can also say these are conjugations of the phase 2 reactions. And remember, these enzymes are usually located in the endoplasmic reticulums also. And what happens is that from the polar compound, you make the highly conjugated polar compound. Conjugated polar compound. So that way, this highly conjugated polar compound can easily excrete out from the kidney. All right? And what from the kidney? Remember, kidney has nephrons, right? So a lot of drugs like penicillin and all this, they get secreted out from if I quickly talk about this one too, let's just make it this easier for you guys. Look, what is this? Let's say this is my what? Efferent arterioles, right? I'm drawing nephrons. And then this is going to be efferent arterioles, and you're going to have proximal tubules, and this is going to be what? Veins. And then you have this Bowman space right here, right? And then you have, what is this called? Proximal tubules. And then you have this loop of Henle right here. And then let's say this is thick ascending long, thin. And then this is distal. and then this is going to be collecting tubules, and then like urine is going to come out from here, right? So urine is going to come out here. So basically here in the proximal, like here, this is a proximal tubule right here, right? A lot from the peritubular capillaries, from here, a lot of drugs get secreted out from here. There are drugs filtered out too, but a lot of drugs get secreted out from this peritubular capillaries into this proximal tubules, and then you exit out. That's how the elimination takes place. Because elimination, when you have highly polar compound, right, highly conjugate, they can easily like go out of the system. Because if they're lipid soluble, remember, if they come to circulations, they will come here, but then after that, like they filter out, but then they'll easily come back, right? So because of that, what is going to happen here is that, it's really important that, these drugs go to biotransformations, which is a phase 1, and that is a P450 cytochrome systems, right? That's where the hydrolysis, oxidation, reductions happens, where you're just unmasking the drug and making the polar drug. And after that, what happens is that you do a phase 2 reaction or conjugated reaction or synthetic reactions where you're adding something like glucuronic acid, or let's say you're adding acetylation, which means you're adding acetic acid, or you're adding sulfuric acid, which is called sulforations, all right? So basically you are doing that. So in that case, when you're doing phase 2 reactions, you make a highly conjugated polar compound. Now this can readily or very, very clearly, these drugs can clear out from your system. And we want that to happen too, right? Because remember, if you're just taking like acetaminophen or something, like you don't want to keep accumulating in our body, you want somehow these drugs to get that system out of our body. So that's the reason why this is very, very important, right? Now, this process that we did to phase 1 and phase 2 reaction, this is primarily taking the liver, right? That's the reason why we often say that liver is the main organ to metabolize our drugs. But remember, and liver is not the only one. Lungs does it too, like your kidney does it too. But liver is the main site, all right? That's the reason why, a lot of times, when you take like increased level, let's say acetaminophen or something, or even alcohol, why? Because alcohol is a drug. Remember, if you take like too much and all, you get liver cirrhosis and stuff. The reason why is because of this. Because liver has to work a lot more faster, all right, in order to do biotransformations of the drug. Just like this, this metabolism can be affected by a couple of things, For example, like if we have a liver damages or there's a liver problem, that can affect these biotransformations. Or even younger children or elderly people. What happens with that is the enzymes here, they are maybe less functional, or like some enzymes are not activated, or, because of that, what is going to happen here is that the biotransformation decreases, right? In this case, right? And other thing is that tolerance, like drug tolerance, like what happens, like if you keep taking simple drugs, like, let's say keep taking a drug every single day, or let's say caffeine, you always take coffee, right? If you keep every single day, if you take a coffee, what is going to happen? Liver is going to start making the enzyme to degrade that coffee, right? Much more quicker. So it has a lot more enzymes. So a lot more enzyme to convert into the highly conjugated polar compound. And remember, whenever drugs is highly polar conjugated compounds, or this one, we call them metabolites. And metabolites are usually what? Meaning it went into the process of metabolism, so they're metabolites, and these are inactive, right? So if there are a lot of enzymes are there, and if there's a less amount of drug is there, but there's a more enzyme to like break down, and what is going to happen? Break down into this polar compound. That means the drugs is not going to diffuse through, and then it's not going to have much of like effect, correct? It's not going to have an effect. That's why you have to increase the dose or increase the concentrations of drugs, so that way that you'll continue having the effect, right? That's why this metabolism can be affected by the, your tolerance level. But then if you, let's say after like you stopped drinking coffee, but then after 2 or 3 months, you started taking drugs, that means even the smaller dose, you'll have what? Even with the small drugs, you'll have a increased level of stimulant. That's what you feel. All right. So again, your metabolism it can be affected by obviously drug interactions also plays a very important role. Anything that can affect this biotransformation like liver cirrhosis or any liver diseases, that is an important one. Even even younger children or elderly people, because what happens is that because of their enzymatic functions or their, maybe those, for especially younger children, like infants and all that, the enzymes are still like developing, or, they're still going past development. In that case, or old age, all right? So these are the factors, all right, that can affect this metabolism process. And same thing with the distribution too. Distribution can be affected by what? The plasma protein. Basically, if there's like increased amount of plasma proteins, right, and that can bound the drugs, then what is going to happen is that is going to affect it. That's also why, like, it's really important that, certain drugs, when you give certain drugs to the patient, you also need to monitor the, drug-to-drug interaction, because some of the drugs there, when you give a drug, what is going to happen? One of the drugs will bound to the plasma proteins, and then when the other drug comes, what is going to happen? They'll kick that drug who is already bound to plasma proteins, and then the drug that you're currently giving, that will attach to the plasma protein. In that case, what happens? The other drug, which was not supposed to leave the plasma protein, that will go and have other functions, and that can result in toxicity. All right. So that's the reason why it is really important to know the backgrounds of like whether they are taking any of the drugs before you prescribe new one. So that way you know exactly, know the, drug-drug interaction. So that way you can actually effectively give a right dose and also effectively prescribe the medication too. At the same time, when I'm talking about doses, you also don't want to, prescribe like a same amount of drug to the whatever amount of drug you prescribe to like elderly people, like adult. You don't want to give that to children as well, right? Because for that one, you got to figure out like, the person's age, body weight, all of that in order to give a correct dose of the drugs. And in next class, I'll talk about like how to determine like, the doses whenever you give to a patient. All right. We'll talk about that too. Whenever we talk about pharmacodynamics, yes. Once the drugs becomes like conjugated, right? Highly conjugated. This is going to go and exit out from the kidney system. And this process, when you get exit, we call them eliminations, all right? Whenever we talk about this, the eliminations, there's also equation that's given. And that is called like rate of, like, the clearance is equal to, like clearance is equal to a rate of eliminations, right? Of the rate of eliminations of the body. And also one thing that you remember is that what is the drug level in the plasma, all right? And that's how you can figure out the clearance of the drug. But remember, drug does not only like clear out from your, your kidney, because only those metabolized drugs that went to the cells, that get, extracted out from kidney. But there's certain drugs, there are the other drugs, what happens is that, they didn't go to process of biotransformations, all right? What happens is that they didn't get absorbed at all. And those drugs will either go through your fecal route, right? Through your poop. That's how you eliminate drugs. Not only that, the drugs that can also go out of your system, like for example, like sweating. When you sweat, right? From your lungs that come from whenever you're breathing, right? That also from there, the drugs can excrete out. But the main ones are going to be obviously like through bile and then the fecal route. And other one is going to be obviously, that's going to be your urine. All right. That's the reason why a lot of times what do? We check the urine level for the drugs. All right. So because it goes to the process of biotransformations. All right.